Welcome to the audio blog section of the Journal of Women and Child Health. Our current audio blog is based on Saving Lives: Efforts to Reduce Child Mortality Rate in the World's Most Vulnerable Regions. Child mortality rate is the number of deaths of children under the age of 5 per 1,000 live births. It is often used as an indicator of the overall health and well-being of a population. Child mortality rate is an important indicator of the overall health and well-being of a population, as it reflects the access to basic health care, sanitation, nutrition, and other factors that are critical for child survival. Understanding the child mortality rate in different regions and countries allows us to identify areas where additional resources and efforts are needed to improve child survival. Additionally, reducing child mortality rate is an important goal in its own right, as it represents the loss of young lives and potential. Furthermore, reducing child mortality rate is also a key indicator of progress towards achieving the Sustainable Development Goals. Sub-Saharan Africa has the highest child mortality rate of any region in the world. According to the World Health Organization, the region's child mortality rate is nearly twice as high as the global average. This is due in large part to a lack of access to basic health care, malnutrition, and poor sanitation and hygiene. Some of the countries with the highest child mortality rate in sub-Saharan Africa include Angola, Central African Republic, Chad, Democratic Republic of Congo, Mali, Niger, Somalia, and South Sudan. These countries often struggle with political instability, poverty, and limited access to health care and education. Additionally, many of these countries are affected by ongoing conflicts, which further exacerbates the child mortality rate. Southern Asia is the second most affected region in the world with high child mortality rate. According to the World Health Organization, the region's child mortality rate is also nearly twice as high as the global average. The main reasons for this are lack of access to health care, malnutrition, and poor sanitation and hygiene. Some of the countries with the highest child mortality rate in Southern Asia include Afghanistan, Bangladesh, India, Nepal, and Pakistan. These countries have large population, and many are considered to be developing nations with limited resources for healthcare and education. Other regions with high child mortality rate include Central Asia, Middle East, and North Africa. These regions also have high child mortality rate due to lack of access to healthcare, poverty, and poor sanitation and hygiene. Additionally, some of these countries may have ongoing conflicts that exacerbate the child mortality rate. Many of the regions and countries with the highest child mortality rate have limited access to basic health care. This can include a lack of healthcare facilities, trained healthcare professionals, and essential medicines. These factors contribute to a lack of treatment and prevention of common childhood illnesses, leading to a higher child mortality rate. Poverty is a major factor in high child mortality rate in many regions. Families living in poverty often have limited access to basic needs such as food, clean water, and shelter. This can lead to malnutrition, poor sanitation and hygiene, and a lack of access to healthcare. Poor sanitation and hygiene can contribute to the spread of diseases and infections, leading to a higher child mortality rate. This can include a lack of clean water, inadequate sanitation facilities, and poor hygiene practices. Limited access to education can also contribute to high child mortality rate. Education can provide individuals and communities with the knowledge and skills necessary to improve health and well-being. Without access to education, individuals and communities may lack the knowledge and resources needed to prevent illness and ensure proper care for sick children. Political instability can also contribute to high child mortality rate. Countries affected by conflict or civil war often have limited access to health care, poor sanitation and hygiene, and limited resources for education. Additionally, political instability can lead to displacement and disruption of normal life, making it difficult for individuals and families to access basic needs such as food and health care. Many governments in regions with high child mortality rate have implemented various initiatives to address the issue. These can include increasing funding for health care and education, implementing programs to combat malnutrition, and implementing policies to improve access to clean water and sanitation. Additionally, some governments have implemented programs to provide vaccinations and other preventative healthcare measures to children in order to reduce the child mortality rate. International organizations such as the World Health Organization, WHO, and UNICEF have been working to reduce child mortality rate in regions with high rates. These organizations provide funding, resources, and technical assistance to countries and communities in need. They also work to improve healthcare systems and policies, as well as to combat malnutrition, poor sanitation and hygiene, and limited access to education. Non-profit organizations play an important role in working to reduce child mortality rate in these regions. These organizations often work in partnership with governments and international organizations to provide funding, resources, and technical assistance. Additionally, many non-profit organizations focus on specific issues such as maternal health, child nutrition, and vaccination programs that directly impact child mortality rate. Individuals and communities also play a vital role in reducing child mortality rate in these regions. This includes educating families on proper hygiene, sanitation and nutrition, and providing access to healthcare services. Community engagement, support and participation are also important in promoting preventive measures to improve child survival. In this blog, we discussed the regions and countries with the highest child mortality rate globally. Sub-Saharan Africa and Southern Asia were identified as the regions with the highest rates, with countries such as Angola, Central African Republic, Chad, Democratic Republic of Congo, Mali, Niger, Somalia, and South Sudan having the highest rates. The main causes of high child mortality rate in these regions were identified as lack of access to healthcare, poverty, poor sanitation and hygiene, limited access to education and political instability. Efforts to reduce child mortality rate in these regions were discussed, including government initiatives, international organizations, non-profit organizations and the role of individuals and communities. Despite progress made in reducing child mortality rate globally, it is important to note that there is still much work to be done. Reducing child mortality rate is an ongoing effort that requires a sustained commitment from governments, international organizations, non-profit organizations, individuals and communities. By continuing to work together to address the causes of high child mortality rate, we can ensure that more children have the opportunity to grow and thrive. Additionally, reducing child mortality rate is an important step towards achieving the Sustainable Development Goals and ensuring a better future for all. This is the end of this audio blog.